Suicide is a growing health crisis all across North Carolina right now.
And today, the state launching a new tool to help track that problem. Cindy Bay is live from Durham with the key takeaways. Good evening, Cindy.
Good evening. One look at the dashboard and you can see that so many North Carolinians are asking for help. Nearly 30,000 calls were made for interpersonal family reasons. The other two reasons being depression and anxiety. And as the state says, it takes 14 seconds to answer the call. They hope that by learning from this data, this life-saving tool could be better. Nearly 100,000 calls later,
it's alarming, but it's also encouraging.
North Carolina has a better look at how they can respond to the growing mental health crisis in today's society. The State Department of Health and Human Services launching a performance dashboard that shows how North Carolinians are using the 988 Suicide and Crisis Lifeline.
We collect information only if the caller is willing to share that information with us. Unfortunately, suicide is the second leading cause of death for folks 13 to 35. And that's far too high.
Kelly Crosby is the director of the NCDHHS Division of Mental Health. She says while they're glad they're reaching young people, it's sobering that so many of them are struggling, namely those in the LGBTQ+ community.
We get a lot of kids that come in and are experiencing a variety of different mental health things, whether it is anxiety, whether it's depression.
In Durham, the LGBTQ Youth Center is a safe space. Co-program director Freddie Perkins telling me they see an average of 15 kids a week.
They have really built their own sense of unity and community by nature or by way of our drop-ins.
Since the data on LGBTQ+ was added in July, there have been more calls made among young people. As tools like the 988 dashboard puts a spotlight on mental health, Perkins says how more can be done in overcoming the stigma.
In addition to something like a hotline, right? Like having someone to talk to, even here at our drop-ins, even if the kids don't talk directly to us, they've gotten to a point where they are comfortable enough to speak with us in the space, and so we learn and find out a lot about them just through listening and just being present, and I think that gives them a lot of peace and a lot of solace as well.
And as for the public health perspective, Crosby says some of the things that the state can work on is how they can better access older adults with the hotline, and also perhaps connecting callers with a network of providers that could potentially see them the next day for appointments. Reporting in Durham, Cindy Bay, ABC 11 Eyewitness News.
Cindy, such an important resource. Thank you so much. And we want to show you that life-saving number again. If you or someone you know is considering suicide, call 988 to get connected to health professionals who can help.